You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. Hey there, it's Dr. Justin Marchegiani. Welcome back to Beyond Wellness Radio. Today we have a great guest, Dr. Patel. She's out in the Bay Area. Where are you, up in Vallejo?
In Walnut Creek.
Walnut Creek. Awesome. Great. Yeah, you went to med school out in Vallejo over at Toro, correct?
Yep. Yeah.
Excellent. And Dr. Patel is a expert on medicinal marijuana, so we really look forward to kind of diving into all the key topics in and around that. Side effects, benefits, THC versus CBD. We'll run the gamut today and go over all these areas. So, Dr. Patel, how are you doing today?
Good. I'm doing really well.
So, what did you have for breakfast?
For breakfast, I had a protein bar and a glass of half and half. Kind of an unusual breakfast. Got
it. Okay. Today, I'm having a little smoothie here.
Okay.
My wife made it with some collagen. So, about 20 grams of protein and a lot of good phytonutrients. We're starting to juice some beets because the beets are really high in NO2. They're really good vasodilator to help with the blood flow. So my brain is ready. So let's dig in.
Okay. All right. Let's go.
So tell me a little bit more about yourself. How did you get into this field? During the pre-interview, we kind of talked about it a bit. But how did you find your way around this field? And we'll start there first.
Sure. So basically, I happened upon an ad on Craigslist that said medical marijuana doctor needed. And at this time, I was training in emergency medicine. And as I was going through my training, some interesting things were coming up. Well, not so interesting.
Yeah.
Basically, what was going on was that I was seeing a lot of overdoses on opioids, whether they were intentional or unintentional. Then the other thing I was seeing is that what had started off as a prescription for patients turned into an addiction for patients. So these patients would then come into the emergency room trying to finagle a prescription out of doctors for these opioids to feed their addiction. Then the other thing is that I also did a toxicology rotation, and the sole purpose of this rotation was to treat overdoses, mainly on prescription medications, but also over-the-counter medications as well. Okay, so as a doctor, I really this is all sitting really heavy with me because my ultimate purpose as a doctor was to impact lives, to change lives in a good way. And instead, what I was doing was essentially handing out prescriptions to kill, and then seeing the aftermath of it and having to treat the aftermath of it. So when I happened on this ad, it definitely piqued my curiosity because I hadn't known at that point that the field existed, and started looking into the research and was definitely compelled by it from a standpoint of medical marijuana treating chronic pain. So then what I did was a year later, after going through all the research, I then decided to work at a medical marijuana clinic because I wanted to gain clinical experience. And that's pretty much how the whole journey started about half a decade ago.
Excellent. So, with your experience with medical marijuana, I imagine you're probably making a couple different recommendations, like THC versus CBD types of marijuana. Can you kind of just differentiate the two, the tetrahydrocannabis versus the cannabidiol? And can you talk about who you
Sure.
would recommend what strand to? Maybe there are other strands that you're used to that our listeners aren't.
Yeah. So marijuana makes mainly two different types. Well, it makes a whole bunch of different chemicals, cannabinoids,
Yep.
but it makes two types of chemicals in high concentrations, and that's the THC and the CBD that you're referring to. Okay. Now, THC is a psychoactive compound. That's typically what causes the high. Okay.
Yeah.
CBD is non-psychoactive, doesn't cause any sort of high. Now, in terms of combinations of chemicals, it really varies by medical condition. Okay, so let me give you a couple examples.
Yeah.
Someone with multiple sclerosis, mainly what they suffer from is a lot of spasticity. They get basically, think of a Charlie horse times 100, so pretty painful experience. And so for them, higher amounts of CBD are very helpful because CBD is an antispasmodic. Okay. Now, I don't know if you've used marijuana, but or if you know that marijuana typically has this forget I don't know what word I want to use, but basically one of its characteristics is that it causes the munchies, right?
Yeah, exactly.
So that is actually beneficial in, for instance, cancer patients undergoing chemotherapy. Okay.
Where they have lots of nausea and they're not getting enough calories in there because of their because of the cancer and the
Yeah, so in those patients, they benefit more from high amounts of THC because it tends to stimulate appetite. And then there are conditions that benefit from most. Those are mainly inflammatory conditions like psoriasis, for instance. A big component of psoriasis, of autoimmune conditions, are inflammation, and they tend to benefit from both. So it really depends on the medical condition that you have, as well as the combination of medical conditions that you have.
Got it. With THC, I really haven't done marijuana that much in my past. I mean, I've done it a few times. Maybe the last time I did it was maybe 10 years ago. Now, the biggest issue with me and marijuana is it makes me tired and it gives me the munchies. So I'm eating all this crappy food and then I'm feeling really fatigued. So obviously, when we look at who we'd recommend it for, there's going to be specific conditions. Like you mentioned, the CBD, like really great for epilepsy. I have patients that do some of the CBD oil or some of the CBD tinctures, and it does great for joint pain and just chronic pain issues.
Okay.
So the THC patients, you mentioned the cancer, it makes sense because of the low appetite, right? The cachexia from the cancer and such. So they get the more calories into the THC makes sense.
Sure.
Is there any other recommendations or people that benefit from the THC outside of the cancer patients?
Yeah. So like I said, some autoimmune conditions do benefit from
so autoimmune with the THC too?
Yeah. And as well as patients that are suffering from fibromyalgia as well. Okay. I'm trying to think what else off the top of my head.
Do you try the CBD as well for those patients? Do you find the CBD is as effective, or do you see the THC is still being better for some of those patients?
So with autoimmune conditions in general, I found that you need both. Same with fibromyalgia, you need both. So it's just going to depend on the medical condition specific.
And what's the delivery mechanism? Because when you're smoking, you're getting the heterocyclic amines and the polyaromatic hydrocarbons from the incineration of the paper or the marijuana. What do you recommend? Do you do like tincture? Do you put it in foods, edibles? Do you do it in a vaporizer? How do you recommend the delivery?
Okay, so delivery method, again, some delivery methods work better for certain conditions than others. There's a wide variety of delivery methods. Now, typically, I don't recommend that my patients smoke, okay, because long term, it does do damage to the lungs, okay? But other methods include tinctures, which are drops that you put on the tongue. There are also topical formulations that you can apply to the affected area on the skin and anything that's affected beneath it. You can also, let's see, what else is there? There's rectal formulations, there's vaginal formulations, there's edibles, as you mentioned. Mainly what you're going to find are going to be chocolates and gummies. But what's interesting is that the industry has evolved because now we also are finding gluten-free options
Yeah.
and sugar-free options and vegan options as well. So a wide variety of options that are available to patients. Vaporization is another alternative to smoking. It's a method of inhalation. So it's really, again, just going to depend on the medical condition, because a lot of main differences is how long it takes for these methods to take effect, how long they're, because with each method, what mainly varies is how long it's going to take effect, and also how long it's lasting in your system. So all of that can play into what's going to work well for your particular medical condition.
And generally speaking, what are like let's say the top three? I know it's condition specific, but would you say
Yeah.
tincture, kind of a vaporization mechanism, or cream? What are the top three, would you say, that you're recommending
Top
most of the
three,
time? Yeah.
top three, ingestion,
Yeah.
sublingual, so under the tongue,
Yeah.
and vaporization. Those
And
are the top three.
sublingual, is that like via like a alcohol dropper, or is it glycerin? What's the mechanism?
It could be glycerin,
Mm-hmm.
alcohol, or sometimes they even use oils
Okay. Very cool.
as a base. Yeah.
Very cool. So we have the THC, we kind of have the CBD, right? And I've seen a
Yeah.
lot of patients that the CBD is not going to have the psychoactive component, correct? So you can
Yeah.
operate, drive a car, do things like that you may have
Well,
no or yes.
well, I still wouldn't recommend uh, driving a car or operating heavy
So
machinery. Well,
any type of marijuana, even if it's non-psychoactive, you
yeah,
still wouldn't want to like drive or
yeah.
operate heavy machinery. Is that
Yeah,
correct?
because it can still impair your coordination. It's dose dependent. So I tend to err on the side of caution, because if you overdo it, it could potentially impair your coordination. It's just like alcohol, right? You have a
Yeah.
glass of wine versus you have a case of beer. It's that sort of thing. So I tend to err on the side of caution. Now, the other important thing to keep in mind is that the way laws are established in most states is that if marijuana is found in your system, and you were, driving, carelessly, then that is a potential probable cause for a DUI.
Exactly, and they quite haven't figured out the best way to test it. There's some salivary tests that are starting to come out with that can test it acutely, right?
Yeah, well, it's all very preliminary, because here's the thing with marijuana.
Yeah.
It lasts in your system. It's a fat soluble compound, so
Right.
basically, it gets stored in the fat cells in your body. So what's difficult is that with alcohol, you can tell, that somebody used it within the past
Absolutely.
couple hours.
Yeah.
That's not the case with marijuana. You could have used it, like 45 days ago, and it's still present in your system.
But it's going to build up. So if you're using it more acutely, if let's say you use it once in a while, it won't last more than a few days, correct? Versus if you're a chronic user, it can last up to a month.
It all depends. It depends on how a lot of it comes down to how you're processing these chemicals and how you're processing fats. And as you know, we all process fats differently. Some of us tend to hold on to
Yeah.
our fat cells more strongly than others.
Got it. And I see like
Yeah.
Joe Rogan's a big like proponent of like marijuana, and he seems to think it's a lot safer, like regarding behind the wheel and such. I've read some of the studies looking at reaction time on marijuana, and there's good and bad. There's some that say it's no problem, others that say it's just as bad as alcohol. Some say it's really dose dependent, so dose and time dependent. So if let's say you smoke a joint, within a couple of hours afterwards, your reaction time will be impaired. What's your opinion on that? Like, how long are you truly impaired when you do that? What's the side effects like from a time profile and dose dependency?
Okay, so tricky question, right? Because we in terms of how long, so here's what we don't know.
Yeah.
We don't know at what point, at what cutoff that you're not going to be impaired, okay? And at what level, like with alcohol, we have blood alcohol concentration levels, right? So we know at what point you're going to where you're not impaired versus where you are impaired. We don't know that information when it comes to marijuana. That we don't have that cutoff, which makes it difficult. So typically, to err on the side of caution, I tell my patients, don't drive for 8 to 10 hours after consuming marijuana.
So probably better to do it at the end of the day so you can sleep it off, so to speak.
Yeah, typically. Or if you're going to do it during the daytime, then make sure you have a caretaker who can drive you places, sort of thing.
Yeah, or pull out your Uber app, right?
Yeah, or pull
Yeah,
out Uber.
exactly. So we kind of went over some of the pros and cons there. So I've seen
Yeah.
studies on both sides of the fence, but in general, do you find that people that have marijuana in their system have that slight bit slower of a reaction time?
That's what the research says,
Yeah.
especially when they're put in a car. They again, it depends on how much they've taken, but they do have a slower reaction time. It's almost like they're driving even, extra
Yeah,
cautiously.
exactly.
Yeah.
And then what about marijuana compared to alcohol? I mean, I've seen some studies that look at like students that had the highest grades, for instance, and they looked at the ones and they compared usage of alcohol to marijuana, and the ones
Uh-huh.
that had the higher grades were the ones that used more marijuana than alcohol. And the big reason why is the hangover. You don't get the crazy hangover like you do with alcohol with marijuana as much. So can you kind of
Yeah.
compare and contrast, from a side effect standpoint, what your opinion on those two are?
Yeah, sure. I actually have a funny story. So back in high school, um, uh, before our physics test, AP physics test,
Hmm.
there were these group of kids that would go out and they would smoke weed, and
Yeah.
then they would come back and take the test and ace it.
Yeah.
And I remember being like, "What the heck?" Like when you're in
Yeah.
high school, you're kind of under this naive impression that, oh, they're doing a bad thing. They
Yeah.
shouldn't like be doing well on the test.
Yeah.
But in any case, in terms of addiction potential, okay,
Yeah.
marijuana versus alcohol. Um, uh, Alcohol is actually more addictive
Hmm.
compared to marijuana, and I'll spit out some numbers here. The potential for addiction in anybody that's been using marijuana on an everyday basis, and in this particular study that I'm referring to, these patients um, or these participants were using marijuana specifically to get high.
Yeah.
The potential for addiction was 9%. With alcohol use, basically the gauge that they used was anybody who used alcohol more than, I think it was like 12 times in a year, the potential for addiction was 14%. So there is a difference in the potential for addiction. It is a lot less addictive, but there is still a potential for addiction when it comes to marijuana. Again, it comes down to how you use it. Same with alcohol. I go back to that glass of wine versus a case of beer example.
Got it. So basically, a 50% increase in addictive tendencies with alcohol compared to marijuana, so to speak.
Yeah, yeah,
And
yeah.
are there any things that you mix with it, or you recommend your patients take with the marijuana to lessen the side effects? So, for instance, with my patients, if they're going to consume like some healthy alcohol substitutes, right? Let's say a cleaner version of wine, or let's say my Dr. J's Moscow Mule, I'll recommend like vitamin C, NAC, or activated charcoal to kind of help blunt the hangover and to help decrease the alcohol
Yeah.
side effects. Are there things that you recommend for patients that are doing the THC or the more psychoactive components to help lessen those side effects?
Okay, so here's what I'm going to tell you. Uh, what we do know is that marijuana is processed about 70% of it in the liver. Okay.
Yeah.
So I don't have factual information from you, but based on theory, anything that helps to uh, uh, enhance this processing, and mainly of the cytochrome P450,
50,
which is
yep.
basically the mechanic that we have in our liver that
Yeah.
breaks down chemicals. Anything that helps to enhance the effect of that would help to um, uh, 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 break down the marijuana more. So from a theory standpoint. Now, but the other thing to keep in mind is, again, it's fat soluble. So really, the only remedy in that sense that you have is time.
Got it. So anything that's really
Yeah.
going to upregulate your cytochrome
Mhm.
P450 oxidase pathway, maybe NAC, milk thistle, vitamin C, extra B vitamins, those things that run those pathways, is that a good idea?
Yeah, potentially. You can
Potentially.
try. I don't know if there's any validity to it or not. I'm telling you based on the science that I know.
Science, right,
Yeah.
based on the fat
Yeah.
soluble
Mhm.
detoxification. Totally
Yeah.
makes sense.
Yeah.
And what types of marijuana products are you recommending? Is everything going to be at a pharmacy where you're writing a prescription, or do you provide like a medical marijuana card and they go to one of these shops to procure it? How are you compounding that? How are you delivering it? And do you have any of your own supplements you recommend?
No, so by law, physicians are not allowed to, the federal government actually has this rule in place.
Hmm.
Physicians are not allowed to aid or abet patients in obtaining marijuana.
Got it.
Okay. So basically, in states where marijuana is either medically or recreationally legal, you have licensed facilities licensed by the state. They're specifically designated to sell marijuana products, and typically they're called medical marijuana dispensaries.
And so you write a prescription or give them a prescription for a medical marijuana card where then they can go to these dispensaries and procure it?
Yeah, and the thing is that it's actually not a prescription because, again, because it's a class 1 substance per the federal government, which is basically a designation that this is a substance that they consider has no medical value and is highly addictive. You can't write a prescription for it. So really, the terminology is a recommendation or what's called a medical marijuana card. So the way the process works in California is that you go and see a physician. Really, it could be any licensed physician, but not all physicians are open to writing recommendations.
Totally.
So typically you have medical marijuana doctors, and you go and get evaluated by the doctor, and then based on
what does that look like? Is it if a clinical exam, certain tests? What are you doing? So I walk into your office. Let's say I have some type of symptom, and you want to address that with the medical marijuana. How do you evaluate me?
Okay, so it depends. If you go to a shady clinic, it's a 5-minute process. Sometimes you even see the doctor over Skype.
Yep.
And they may or may not speak to you, maybe ask you 1 or 2 questions, and then that's it. It's sort of a done process, done deal. But then there's doctors that practice differently. This is a route that I've chosen to take, which is that, I sit down with the patient, we go through their medical history, we go through their surgical history, I go through the medications that they are on and that they have taken for their particular medical conditions. Then I do a focused physical exam, and then I walk them through how to safely use the marijuana for their particular medical condition. And then, based on my evaluation, if I feel like they'll benefit from the medical marijuana, I issue what's the recommendation and the medical marijuana card. And then you can then take this documentation to a medical marijuana dispensary, and then that allows you to gain entry into the dispensary. Now, there's no restrictions as to what the patient's not limited in terms of what they can buy. The guidance that I give them is simply just that. It's guidance.
So you make a recommendation, let's say how many times a day or how many times a week. I want to see what that looks like, and then they can obviously go above or below that, correct?
Yeah, it's really up to them. It's not like a prescription that you get from a pharmacy. It's not as restricted, which is kind of funny. Yeah.
So you get these patients coming in. Let's just say I'm coming in and I have anxiety or some kind of mood issue, and you're trying to prescribe some marijuana to kind of help relax me and calm me down. What would that look like? So we go through my history, no major issues, right? What would your recommendations be after that? How would you dose that or recommend that per that issue?
So here's what I'm walking the patient through specifically. I'm walking them through the combination of chemicals to use, how to read a label to find those combination of chemicals.
And chemicals meaning like THC or CBD, is that what you're referring to?
Mainly. And then I'm walking them through how to figure out the appropriate dose to take, when to take the marijuana, how often to take it, side effects, what are the side effects, what to do in case they do get side effects, how to avoid the side effects. Those are all the different things that I'm walking patients through. Yeah.
And then what does the dosing look like? Is it kind of like a 1 time per day kind of thing, or are you recommending more or less?
So I've never recommended that patients take it more than once in a day. My biggest concern with marijuana is tolerance. Okay, just like most other medications, if you overdo it, if you take it too often, if you take too much of it, then you will develop a tolerance to it. Okay,
and you need more frequency.
Yeah. So there's a scientific reason behind this. What is it? So every cell, has well, not every cell, but a lot of cells in our body have receptors for these chemicals in marijuana, okay? But if you overexpose the cells to these receptors, the cells will stop making the receptors, okay? So basically you get to a point where you start to need more and more of the medication, but guess what? You're not necessarily getting the same effect from it, okay?
Got it.
optimal effect from it. So my main priority with my patients when I'm educating them is we focus on the lowest effective dose and minimal frequency.
Got it. So it's kind of like insulin resistance. If someone's consuming too much refined sugar or too much carbohydrate, those insulin receptor sites that pull in the sugar kind of down-regulate, and essentially the cells become numb, so then more sugar accumulates in the bloodstream and doesn't get into the cell to have the effect. Same kind of thing with the marijuana, right?
Yep, receptor downregulation. Yeah, you said it.
And so what are the things that you are doing to help mitigate that, and also to mitigate the side effects too?
Again, we focus on lowest effective dose and minimal frequency. Yeah, and that's gonna vary from patient to patient. Dosing varies highly from patient to patient. So
and let's say they cross the line though; they're already at the point where they're doing it a little too much. Is there something they can do to increase the potency, or to kind of bring it back and still get that potency again?
Yeah, you cut back on what you're using. Yeah.
So pretty straightforward there. And then when you're looking at like THC strains versus CBD strains, do you have any specific strains that you like or you recommend the patients on either side of the fence?
Yeah, let's talk about strains.
Yeah.
A lot of them have kind of funny names, right?
Yeah.
So like, let's see, train wreck, purple train wreck.
I love it.
What else is there? OG Kush, all sorts of interesting names, creative names that the growers have come up with. Here's the thing, though. Strains are named very arbitrarily.
Right.
In fact, recently I was reading a study that was done. They looked at a bunch of different strains that were called the same thing from different different dispensaries. And guess what? They all had differing amounts of THC and CBD in them.
Got it. So it's not standardized across the board.
No, it's not. And so the thing is that the other thing is that you can pick up let's call it a Granddaddy Purple. Okay, you can pick up a Granddaddy Purple at a dispensary one time, and then you go to the same dispensary the second time, and it can have a completely different combination of chemicals. Same thing if you go from one dispensary to another dispensary. Granddaddy Purple at one dispensary is completely different from a Granddaddy Purple at another dispensary. So what I'm really honing in on with my patients is laboratory testing, and specifically laboratory testing for the exact amounts of the different chemicals. And being in California, I think patients here are very fortunate because products are laboratory tested.
Yeah.
So main states where laboratory testing is state mandated are the states where marijuana has been legalized for recreational use. Even in states where marijuana is legalized for medical use, not all states necessarily mandate laboratory testing. Why? I'm not certain why that's the case. But in California, again, it's still not mandated. It will be starting 2018 once the recreational use regulations go into place. But it's been being done recently on a voluntary basis. So patients here are fortunate, but otherwise you are at a loss because you're not going to know what's in whatever it is that you're using.
Got it. I'm noticing there's more over-the-counter CBD oils on the market now. So the CBD strains. So do you have any companies or products that you like that are over-the-counter that you recommended the patient with good success?
Okay, so let's talk about rules and regulations because this is important. Recently, in December of 2016, the DEA deemed CBD a Class 1 substance. So I know that I had a lot of patients come in to my office that were using over-the-counter CBD products that they found on Amazon or at health food stores. So there may be a change going on. Now I know the last I read, I believe somebody, I think, filed some sort of lawsuit saying that the DEA can't do that. It's not up to them. It's up to some other, I forget who it was, but some other governing body that has authority to do that, not the DEA. So the legal status of that is still in question. But here's what I'll tell you. The patients that have come in, having used those over-the-counter products, they've come in to me specifically because they haven't had success with the over-the-counter products. Now, obviously, I'm not seeing the patients that have had success with the over-the-counter products. Main thing that I would tell people looking to use those products, make sure you research it well. make sure it's laboratory tested.
Yeah.
Look to see what the exact amounts of the CBD are in that particular product. And these products are typically derived from hemp. Okay?
Got it.
So, main difference between hemp and marijuana, basic fundamental difference, hemp has less than 0.3% THC. So it's going to have a lot less THC in it. But like I mentioned, some conditions do benefit from THC.
And the marijuana plants today, they're upwards of 20% THC. Is that
Oh,
correct?
yeah. Yeah. So back in around the 60s, they did some research, and the potencies of THC in these flowers that were just, confiscated from growers was about anywhere from 2 to 5%. Now, it's not unusual to see THC levels in flowers of 20 to 30% THC. So it has gotten more potent over time, but that's because plants are being bred that way.
Yeah, exactly. Makes sense. And then do you personally partake in any of the THC or CBD marijuana yourself?
Yeah, so I suffer from insomnia.
Yeah.
It's not constant insomnia, but sporadic. Depends on, what sort of stress trigger there is in my life. But if it's something really stressful, then my sleep gets impacted right away, right?
Yeah.
So I start to have difficulty either falling asleep or staying asleep. And during those times, I do use medical marijuana to help me sleep. And then once I get into a regular sleep pattern again, I don't have to use it.
Now, with
So
the go ahead. Yep.
so basically, marijuana can be used as an as-needed medication.
And like we have sleep medications like the Lunesta or the Ambien, but the bigger
Yeah,
problem with those medications is you don't get into the deeper phase 3, phase 4 REM sleep that's more
yeah.
restorative. What do you know about using the marijuana strains and getting into those deeper reparative, restorative REM sleep cycles?
Okay, so there is some preliminary research that shows that THC shortens REM sleep, but I haven't found that to be the case clinically, okay?
Mm-hmm.
And this I'm based on saying after having treated veterans with PTSD. Because a lot of what they experience is sleep disturbance. They'll wake up with nightmares, night terrors, okay, is what they'll describe it to me as. But when they start to use the medical marijuana, now I am having them use higher CBD marijuana, but during a follow-up appointment, I always make it a point to ask them, what's the quality of your sleep like? What about dreaming? And they say, no, I dream fine. I don't have any, it's not like I'm not dreaming. So we need more information, essentially, both in terms of research, clinically. This is what I've seen, but I haven't had too many patients complain to me that, I'm not dreaming. Really, they're telling me that the quality of their sleep overall has improved.
That's great. Very good. And do you combine
Yeah.
marijuana with other types of herbs or nutrients? Do you ever try combining with magnesium or other adaptogenic herbs that can help with stress like ashwagandha or various ginseng herbs? What's your experience with that?
I'm not very well informed about those other herbs.
Mm-hmm.
With inflammatory conditions, I do encourage my patients to use turmeric.
Turmeric, yep.
Because it has very potent anti-inflammatory properties. And then I'm also advising them to make sure they upkeep on taking their omega-3s,
Yeah.
and making sure their vitamin D levels are within normal range. But I'm not really well informed enough about the other herbs to be advising them.
Got it. Those are some good common
Yeah.
sense recommendations. Are you familiar with the field of functional medicine at all?
Oh yeah,
All right,
definitely.
good. Are you using any of those modalities at all, like from a diet perspective or any lab testing as well to look at things deeper outside of just the recommendations for the marijuana too?
I'm not. I strictly just specialize in the area of medical marijuana. So
Excellent.
so
What's your
just
website,
that.
Doc?
Sure, it's www.dr, Dr. Rachna, Rachna, Patel, Patel.com.
Great, and we'll put a link right below the video description and podcast description.
Yeah,
People can get a hold of you. I know you schedule online there as well, so we'll make sure anyone that could use these types of resources. I think that's perfect. I think it's really
yeah,
good, especially you're educating people on both sides, so you're able to make a recommendation on the THC strain versus the
yeah,
CBD. I mean, I have functional medicine patients that have autoimmune issues, and we've made diet and lifestyle changes, working on adrenal health, working on nutrients, but I find that some have done really well in like introducing some CBD oil into their regimen. It's helped with inflammation and help
Yeah.
support their immune system. So I think there's definitely some very good palliative, supportive types of treatments
Yeah.
with those types of supplements, so to speak. I've seen it really
Yeah.
provide good benefit.
So you're in Texas.
hmm
Do you know what the status is of medical marijuana in Texas?
I don't
Just
know. I mean, I don't know. I think
yeah.
it's still 100% illegal. I mean, for the most part, I think it's Colorado, Texas, and then the upper Northwest there. But there are some good CBD oils that are online that patients
Okay.
have used with really good
Sure.
success, like the ones you recommended that are lab tested and such.
Yeah. Yeah. So, yeah, the other thing I wanted to mention is that I'd be more than happy to answer questions for your viewers. And I do that on my YouTube channel and on my Facebook page. So if your viewers have questions for me, they can post them on either one of these platforms. And I put out videos answering commonly asked questions about every 1 to 2 weeks. So
That's
I'd be more
great.
than happy to do that as well. Yeah.
And the Dr. RachnaPatel.com is the site with the links to the YouTube there as well.
Um, I think, yeah, you should be able to find my YouTube stuff on my website.
We'll
Yeah,
make sure we put the YouTube links and any
sure.
other links there in the description. People can easily find that out.
Yeah,
Now, a couple other questions here before we
sure,
wrap up. Now,
sure.
I've read some literature talking about brain development in marijuana. So there's kind of this idea that incorporating or introducing marijuana early can help stunt or essentially retard the development of the frontal cortex here, kind of what make us higher human species. So
Yeah.
can you speak to that more? Is there an age in which you'd recommend marijuana? Like what's the cutoff for you? And do you see any of those neurological developmental delays with exposure early on?
So here's the thing. There was a study that I was looking at that looked at the size and shapes of brains in adolescents that had used marijuana on a regular basis for at least 2 to 3 months. Okay, and they compared it to non-users, and they really found no difference
hmm
in the size or shape of their brain. Right, so
hmm
that's more of a look at it at a macro level. We still need more information at a micro level. But I don't have enough information to give you a cutoff, but I also don't have enough information in terms of if and how it impacts brain development. Now, here's the thing, though. I have had adolescents come into my office who this is really interesting because these are adolescents that are using medical or using marijuana recreationally, and then their parents happen to find out that they're using, and they explore it further. These kids also have a diagnosis of ADD or ADHD, and they end up telling their parents that it's helping me. It's helping me, and I don't like the side effects that I get from basically the class of amphetamines that are typically prescribed for
Oh yeah.
this condition. So I have seen these patients, over now 2, 3 years, and have I found any sort of impact on academic performance, on behavior? No. I mean, when these patients come in, there hasn't been anything like that reported either from the patient themselves or from the parent.
Got it. And you're up in the North Bay area of California. Are you familiar with Dr. Julia Ross's work at all with the Mood Cure or the Diet Cure, where she uses amino acids to help kind of support some of these neurotransmitter levels to help lessen addictive tendencies?
No, I'm not actually.
Okay, I'd be
Yeah,
curious,
but I
kind of
just yeah. I'll
combining
look.
some of those amino acids. Yeah, I think that'd be really useful. Now, obviously, is going to be a difference with the addictive tendencies with THC versus CBD. Do you find people get addicted to CBD at all?
Um, Overall, we know more about THC than we
Yeah.
know about CBD, and we know about overall addictive potential of marijuana, but each individually, I don't know if there's been a study done to compare to the two chemicals. So I really don't have an answer for that particular question.
Got it. Yeah, there was a
Yeah.
neurosurgeon, doctor's, I forget his name on Frontline. He's a neurosurgeon, and he did a article or a whole expose on marijuana, and he
Uh-huh.
was using some of the high dose CBD oils with children that had epilepsy, and it was amazing
Okay.
because you literally see them having a seizure, and then
Yeah.
they put some of the CBD butter oil in their mouth, and it was just like someone just turned the light off. What's the mechanism? What is it doing to the brain to stabilize it to prevent that epileptic seizure?
So a couple of things could be going on. One is that it could be triggering other, basically the chemical activity along the neuron and possibly slowing it down. And this is obviously happening at a biochemical level where it's impacting signaling amongst different chemicals. So that's one thing. The other thing is that it could also be, reducing inflammation that's going on as well. So a couple different mechanisms but through which it could be working.
Okay, very cool. And are you familiar with ketogenic diets at all and having a similar effect with epilepsy at least?
That's not something that I've studied in depth.
Okay,
Yeah.
great. Well, you've really provided some great information, so we'll put the links to your sites down here below. Now, last question. If you're stuck on a desert island and you only can bring one supplement or nutrient with you and it can't be marijuana, what would it be?
One nutrient or supplement with me, it'd be protein.
Protein? I love it.
Some form of protein I'd bring with me.
Very cool. I like it.
Yeah.
Protein is great. Is there any other powerful information on the tip of your tongue that you wanted to share with the listeners before we depart?
Yes, knowledge is power. So make sure you're proactive when it comes to your health and go out there and find credible resources to get information from.
That's great. And if patients aren't nearby in the North Bay, kind of Walnut Creek area, are
Yeah.
you also available via phone or Skype?
Yeah, so here's what I'm doing. I'm creating protocols for medical marijuana by medical condition because I know I found that there's a great need for this information. So that's in the works. It should be out in a couple months. And then I'm also going to make myself accessible through video.
Skype
as
video.
well.
That's great.
Yeah.
Awesome, Dr. Patel. Well, we did this via Skype video as well as audio. So if you're listening to the audio version and you want to see us live, click below for the YouTube link. Dr. Patel, thank you for your time. What a great interview, and I look forward to chatting soon.
Yeah. It was
Take
great.
care.
Got a question for Dr. J? Go to BeyondWellnessRadio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to BeyondWellnessRadio.com.